Tonight, the legalities of pronouns. We look at the potential court challenges that could face the government's school policy changes. Also,
I think you are wonderful.
How AI is bringing researchers one step closer to restoring speech in people with paralysis. Plus, more than 1,000 athletes are competing in Regina this week for the National Pickleball Championships.
This is CBC Saskatchewan News.
It is Thursday, August 24th, and the CBC Saskatchewan News starts right now. Good evening and thank you for watching. Saskatchewan's new gender and naming policies coming to schools this fall are facing criticism, and that could lead to lawsuits. One nonprofit says it will take legal measures to protect the rights of students. Adam Hunter has the details.
On Tuesday, Education Minister Dustin Duncan said parental permission will be required for students under 16 who wish to be addressed by their chosen name or pronoun. Duncan says the policy is specifically meant for a name change related to gender. The Canadian Civil Liberties Association says that distinction makes the policy discriminatory.
Our read of the policy as it's written is that it is specifically targeting trans and gender diverse students with this policy. So that is the discriminatory impact, that it only applies to them.
The CCLA was one of the first groups to condemn the new policy and says it will support and take legal action. Saskatchewan's change comes on the heels of a similar change in New Brunswick. That province's children's advocate says the policy violates the province's Human Rights Act, the Education Act, and children's charter rights.
This is a dangerous and alarming policy that will have harms on young people and students in the province. There's numerous harms that could be resulting from this, including the psychological stress associated with just the lack of freedom of how to choose to be addressed.
Minister of Education Dustin Duncan says the changes increase parental involvement. So-called parental rights policies in Saskatchewan and New Brunswick are being imported from the United States, says this associate professor.
We really have to understand that parental rights is simply a dog whistle for an anti-2S LGBTQ agenda that is about censoring books, censoring educational materials, and restricting the human rights of trans and non-gender vulnerable students in particular.
Wells says he believes the policies in Saskatchewan and New Brunswick will be struck down in court, but he says that court battle will be long and costly and further stigmatize the trans community. Adam Hunter, CBC News, Regina.
A Saskatoon trio accused of drug trafficking and money laundering will be going to trial. Twin brothers, one of whom is a dentist, and a local woman want their charges heard by a judge and jury. They made the decision at a preliminary hearing this week. Jason Lee worked out of a dental practice in River Landing at the time of his arrest. The dental practice is not linked to the allegations. Jason, his brother Jay, and Jessica Tran were all arrested back in January. Police had been tracking them since the fall of 2021. As part of the investigation, police seized a $700,000 home and 3 luxury vehicles. The Saskatoon Police Service has been asked to put together a report about people they're interacting with who have complex housing needs. The force says a small group of people with addictions or housing issues are frequenting cells with nowhere to call home. Police Chief Troy Cooper presented some recent stats to the Saskatoon Board of Police Commissioners this morning. He says 79 people have spent from 10 to 140 nights in detention cells this past year. They're often brought into cells accused of public intoxication or mischief and released the next morning.
They need supported housing. They need people and resources that are adequate for their special needs, and that's not an easy solution. It's not like we could build a home and have somewhere to put people. This is going to take coordinated effort with a lot of different agencies and partnerships.
Mm-hmm. Cooper estimates an interim report could be done in a couple months. Today, the commission also discussed diversifying hiring practice and a lack of staff diversity. It says it's planning an audit to improve recruitment of racially diverse populations. The federal government is trying to come up with ways to ease Canada's housing crisis. Capping the number of international students is one of the options on the table, but there is some opposition. The Liberal cabinet recently met in PEI with housing on the agenda. The Canada Mortgage and Housing Corporation says 5.8 million units need to be built to achieve affordable housing. The Housing, Infrastructure and Communities Minister says one option is to limit international student admissions. The feds say this could lead to fewer students taking up valuable rentals. But one Saskatchewan MP disagrees.
We've been trying to attract newcomers to Saskatchewan to build this province that includes international students. And so any talk of putting a limit on the number of international students that can come to Saskatchewan would be very bad for this province indeed. What happens in downtown Toronto is not necessarily what happens here in Regina. We are a large country with vastly different issues from one region to another.
Stats Canada data shows international post-secondary admissions in Saskatchewan have grown sevenfold since the early 1990s. Saskatchewan's Advanced Education Ministry says it cannot justify a restriction on admissions as long as the school's housing needs are met. The ministry says post-secondary is provincial jurisdiction and the institution should determine what's appropriate. The clock is ticking down on what's left of summer vacation. Schools will soon be full of students and teachers again, and with that, germs. And that could include new variants of COVID-19. For the latest, we're joined by Dr. Joseph Blondeau. He's the head of clinical microbiology at RUH in Saskatoon. Thanks for being here.
Oh, it's my pleasure. Thanks for asking me to come on.
Okay, let's start with the latest variants discovered. What does that mean for us?
So there are a number of variants that are circulating. We know that the EG5, nicknamed Iris, is circulating. There's the XBB 1.16, and then more recently there's a new variant called BA 2.86. That latest one that I just mentioned is rather unique in that it has some 30 defined mutations. There's a close watch going on with that, only because it's been discovered in relatively limited numbers. And at this point in time, it's unclear whether or not it's going to outcompete other variants that are more successful at transmission. But what it means is that we're always constantly watching to see whether these variants will continue to spread within the population, which ones will be dominant, and more importantly, whether or not they would be neutralized, if you will, by the vaccine campaigns that we expect to occur this fall. And early indications are that the current variants that I had mentioned will be neutralized by antibody raised by the vaccines that we're anticipating for the fall. So that's the good news.
What can people do to minimize risk of getting sick or, if they get sick, infecting other people?
You know, Sam, we have a couple of years of data on this by which we were able to show that the policies that were put in place in the pandemic, things like masking and physical distancing, staying at home when you're sick, actually had a profound effect on the respiratory season during the middle of the pandemic, where we saw very little respiratory activity other than the COVID-19 strains that were circulating. So if we look at that information, we can say that those are the same types of things that we can be doing in the current respiratory season in order to protect ourselves and others. It's still okay to wear a mask. It's still okay to stay 6 feet away from other people. Hand washing becomes extremely important, as always. And I think one of the more important things is that if you're symptomatic, stay home. Stay away from other people and allow that time for the symptoms to pass. And then you're no longer infectious.
We're coming into that respiratory season you were talking about. That includes the flu and other viruses. What do we know about this upcoming flu season at this point?
Well, I mean, at this point in time, it's all modeling and predictions, but I think we're expecting that we're going to see a lot of respiratory virus activity this fall. This is the first full fall, I guess, where we haven't been operating under many restrictions, or any restrictions, I should say. Last year and the year before, there were still restrictions in place of various kinds. But I think that this is our first full respiratory season without any restrictions whatsoever. So I think we're actually going to see a lot of respiratory virus activity. And it's not just COVID, but it will be influenza, and it will be a respiratory syncytial virus, rhinovirus, and some of these other viruses that are associated with common colds. And so I expect that we will be seeing all of them this fall.
It's been a while since many of us had a vaccine booster. What are the chances that a booster and the flu shot will be merged into one needle?
So I tried to do a little bit of research on that because that question has come up before. And what expert groups are saying is co-administration. They're not saying one needle with both vaccines in the one needle. They're actually talking about a person showing up for a vaccine and they're getting one shot for COVID and the other shot for influenza. So co-administration, I think, is going to be the way forward, at least for this respiratory season. Whether or not a manufacturer comes out and is able to put both vaccines in the same needle, I guess that remains to be seen. Probably a possibility, but most of the chatter right now is co-administration.
Thanks so much for this, Dr. Blondeau.
It's my pleasure. Be safe.
Dr. Joseph Blondeau is the head of clinical microbiology at Royal University Hospital in Saskatoon. As you just heard, there are some new COVID variants, and there seems to be a rise in COVID cases across the country. Positive tests and hospitalizations are on the uptick as drug makers seek approval for new vaccines. But as Lauren Pelly reports, updated booster shots are likely several weeks away.
I don't want to get sick.
59-year-old Edwina Thomas got her last COVID vaccine almost a year ago. With infection rates rising again, she wants another shot before going back to her job as a school librarian.
I think it's just going to go through us like a tidal wave.
But federal officials say it could still be several weeks before updated shots are approved and rolling out to the provinces.
It is a difficult period, there is no doubt.
Chief Public Health Officer Dr. Teresa Tam says anytime there are new vaccine formulations, Health Canada has to make sure they're both safe and effective.
And that process takes time.
The guidance for most Canadians is to simply wait for the newest versions. They're more tailored to the virus variants circulating right now.
Just waiting is difficult, irritating, uncertain, but still the best thing to do.
This physician recommends spacing out your next shot 6 months or so after your last vaccine or infection. That's because even though antibodies to ward off reinfection will fade over time, deeper protection against serious illness will last longer.
Those of us who've had, 4, 5, 6 doses of vaccine, and most of us have had an infection by now, are pretty well protected.
But that advice isn't one size fits all. Experts say anyone who is pregnant, older adults, or people with other serious health issues may benefit from having another shot sooner, and healthcare providers should consider those requests.
People who are at especially high risk of severe outcomes may wish to consult their physician about whether or not the risk-benefit equation sways for them towards getting an earlier but older shot in advance of a new wave popping up.
Lauren Pelly, CBC News, Toronto.
What a perfect day to get out on the links. These golfers in Saskatoon enjoyed just a light breeze as they worked their way through the course. Looks like golfers who missed out today have some nice weather to look forward to. Ethan will be back with your forecast after the break. Stay with us. Welcome back. New research is giving hope to those for whom medical conditions have taken away the ability to speak. Deshauna Reed shows us how technology could change lives.
After a stroke nearly 20 years ago, Canadian Ann Johnson lost her ability to speak.
What do you think of my artificial voice?
It's the first time since her stroke she's able to use her voice to have a conversation with her husband.
Hey Ann, how's it going?
It is good to see you.
We might need to test it a little bit.
Researchers from the University of California, San Francisco, and Berkeley developed a device and AI technology that allowed Anne's brain signals to be decoded into written and verbal speech.
You are truly wonderful people.
Using Anne's wedding video, they also were able to pair her voice to an avatar that exhibited her facial expressions.
It was really exciting to see how quickly she was being able to get the computer to understand what she was trying to say.
Surgeons implanted a device into Anne's head that interprets brain signals. By attempting to say words, Anne trained the system to recognize the signals that control the muscles involved in speech. They found the technology decoded up to 78 words per minute and reached a vocabulary of 1,000 words.
1,000 words gets us really, really close to the amount of words that most people use in their everyday life.
A new study from the University of Stanford used similar technology on a patient with ALS. This doctor says the new developments could be life-altering.
You can imagine how long it would take to spell out a sentence with your eyes letter by letter. But a brain-computer interface where a word can just appear by thinking about it, that would significantly impact patients' quality of life.
Thanks for stopping by.
Researchers say they are testing safety and working to improve the technology to be more accurate, but say they are optimistic medical devices that can help patients like Anne regain speech will become a reality. Tashana Reed, CBC News, Toronto.
This weather update is brought to you by Capital Ford Lincoln. Employee pricing is on now.
And our weather specialist, Ethan Williams, joins me now. A bit of a mixed bag of weather from north to south in the province today.
Yeah, in terms of sky conditions, in terms of temperatures, even in terms of wind, there's a lot to get to, so let's get right to it. Let's start first with a look at where the moisture is. We still have this lingering area of low pressure kind of centered just to the north and east of Prince Albert right now. Brought through some showers to the Saskatoon area a little earlier this afternoon, and we're still seeing those showers to the north as well. It's been raining kind of throughout the day in the Churchill region as well. That's kind of where we've seen the most rain, but that looks to be moving out now. Of course, as is usually the case, south of the center of that low pressure is where we see the winds, and definitely through southern Saskatchewan has been breezy at times today. Those winds coming from the northwest, especially in southwestern Saskatchewan, at times getting close to the 60-kilometer-an-hour mark. And where we are seeing the rain and where that cloud cover is really where those temperatures are still holding back. Only mid-teens right now in the Battlefords and Prince Albert and Meadow Lake, but the sun came out clearly today in south central and southeastern Saskatchewan. That's where our temperatures are still in the mid-20s even right now, but less humidity today, so not feeling like the 30 that we saw yesterday. Now, that low pressure system going to begin to move out overnight tonight. Lingering showers possible in east central Saskatchewan, and with that moisture, fog possible throughout central Saskatchewan tonight. And then tomorrow morning, as that low moves southward, Regina and portions of southern Saskatchewan, we could see some early morning showers before that clears out heading through the day. This area of high pressure takes care of that pretty quickly, and all of us going to be seeing lots of sunshine, not just tomorrow, but really as we head into the weekend. That area of high pressure is pretty broad. Now in east central Saskatchewan, probably only about another 2 to 4 millimeters likely from rain showers tonight. The Prince Albert area down to Melfort, maybe 1 or 2, but otherwise not expecting all that much. It's on the western side of central Saskatchewan where we could see that fog cause visibility to drop into that 500 meter range, maybe even a little bit less than that at times. Even into kind of those 7, 8 a.m. hours when the commute is starting, you may see that, but then clearing out pretty quickly through the rest of the morning. And as high pressure moves in, good news is that dies down the winds a little bit, but there is a low pressure system moving through the Northwest Territories and Nunavut over the weekend, and that could pick up gusts a bit, especially as we head into Saturday. And that means for northwestern Saskatchewan in particular, we have seen the air quality advisory for the Uranium City area come to an end, but this model showing some surface smoke beginning to move back in from fires in the Northwest Territories, and that could result in a bit thicker smoke at times and possibly the reissuing of those advisories. Now for Regina, again, I think we could see maybe a little bit of rain early tomorrow morning before that clears out, but we'll be cool, just a bit below normal, but really pretty close for this time of year. And then sunshine, of course, taking over with that high pressure, and temperatures quite nice for the weekend, getting summer-like again for the start of next week. For Saskatoon, again, I think we'll kind of be in that low 20 range tomorrow, but mostly sunny conditions for you. Riding a bit of a temperature seesaw here and there over the next few days, but enjoying that real warmth on Tuesday before some rain showers and some cooler temperatures moving through, Sam. So if you like the sunshine, definitely a lot of those days in store.
I like the sunshine, but my hair has a question. Are we done with the humidity?
You know, I think we are looking for drier conditions now with this high pressure. So your hair can thank me.
Thanks, Ethan.
You're welcome.
My deepest apologies.
Rod Stewart apologizing to his Saskatoon fans on Instagram. The 78-year-old bailed from his concert on Saturday night. Fans were already in the audience, and it was less than an hour before he was supposed to take the stage. The singer says he was in the building, and just before he went on stage, he got a cramp in his vocal cords while he was warming up. SaskTel Centre says the concert's not being rescheduled and that it is refunding tickets. Stewart is fine. He played in Ottawa last night. We'll be back after the break.
When it comes to your news, you want up-to-the-minute access. Anytime, anywhere. Get the facts straight from the source. Download the free CBC News app or visit cbcnews.ca for news you can trust.
Russian President Vladimir Putin has offered his condolences to the family of mercenary leader Yevgeny Prigozhin. The leader of the infamous Wagner Group reportedly died in a plane crash north of Moscow yesterday.
Он был талантливый человек, талантливый бизнесмен.
In a televised address, Putin offered a modest praise for Prigozhin, calling him a talented businessman. Putin also called him a man with a complicated fate who had made serious mistakes in his life. Prigozhin had been a key Putin ally until 2 months ago when he staged a mutiny against Russia's military leadership. Putin's remarks are the first official confirmation of Prigozhin's death beyond a statement from Russia's aviation authority. A criminal investigation into the plane crash is underway. And Ethan is back with one last look at your weather.
And it'll be a little hazy potentially tonight in Regina. Those northwest winds could be bringing in a bit of forest fire smoke, looking for 12 degrees. And those winds a little bit breezy before dying down overnight. Tomorrow morning, as I say, there is the slight chance we could see a shower by 8 a.m. still lingering. Otherwise, looking for kind of a more mostly cloudy start today for the day before things start to clear out as we head toward the afternoon. May not even be above 20 degrees by the time we get to the afternoon, though, but that high pressure making those winds fairly light. For Saskatoon, again, a little bit breezy at times overnight tonight. And getting into tomorrow morning, there's the possibility we could see a few patches of fog lingering here and there toward the afternoon. You'll be clearing out, though, looking for 18 degrees, nice light winds. So, Sam, a little bit on the chilly side, but otherwise, actually not a bad day.
It's time for the fall seesaw of weather.
Yes. Pumpkin spice, anyone?
You already had some. Thanks, Ethan.
You bet.
And before we leave you tonight, there's another big sporting event in Regina that you might want to check out. No, this isn't badminton or indoor tennis. It is pickleball, which is the fastest growing sport in North America. The best players from across Canada are in the Queen City right now. More than 1,000 athletes of all ages and levels are at the Viterra International Trade Center for the tournament. It started yesterday and it goes until the 27th. You can check it out in person or stream the games live on the CBC Gem app. And that is it for us tonight. For News Anytime, you can head to our website, subscribe to the CBC Saskatchewan YouTube channel, or download the CBC News app. Ethan and I will be back with more local news and weather at 11. Thanks for watching and have a great night.